Hey, Ohio, it is May the 14th, 2026. I want to talk about HB 324. This is a bill that has passed out of the Ohio House and is now in the Ohio Senate Health Committee. And this is a bill trying to dictate which medications can be prescribed after a telehealth visit in Ohio. And the impetus of this bill initially seemed to be restricting medications used in medication abortion like mifepristone to try to put up barriers to care, essentially saying, oh, you're not going to be able to prescribe medications like this after a telehealth visit. You have to have an in-person visit before and after. And how they're trying to do this is this kind of loophole way where they're saying, we're going to say medications that have a greater than 5% serious adverse event rate only can be prescribed after an in-person visit and then with a follow-up in-person visit. And if anybody knows anything about mifepristone, they know we have decades of clinical trial data and patient safety data showing that drug has a very low serious adverse event rate, less than 1%. So naturally people will be like, well, why are you worried about that? Well, because in this bill, what they're saying is, oh no, we're going to determine drugs in Ohio that are safe or not. We're going to use retrospective insurance data here in Ohio. The Ohio Health Director and the superintendent of insurance, and we're going to use retrospective insurance data to determine the serious adverse event rates of drugs. And we're going to use that data and we're going to say it's going to override all this other better data. And if you know anything about levels of evidence, retrospective insurance data is like the lowest level of evidence. We have way better evidence showing that these drugs are safe. But again, this is a sneaky way for them to chip away at access to reproductive care in the state. And when this bill came out, we were all worried that they would extrapolate this to other medications other than just, medications for reproductive care. And that became more evident yesterday when Representative Adam Matthews, who was a co-sponsor on this bill, gave testimony in that Senate Health Committee, and he brought up SSRIs and basically made a statement that he hopes this bill prevents things like SSRIs from being prescribed without a in-person visit, stating that we shouldn't be allowed to do a telehealth visit and prescribe SSRIs. Anybody that knows anything about access to mental health care knows that this would just create more barriers to care. 75 of our 88 counties do not have mental health care professionals that they need. We have a primary care shortage in many areas. So limiting access of these medications to only in-person visits does not help people. It does not keep them safe. And, we often do telehealth visits or even telephone calls with our patients when they're having issues. And we go over all the safety data. We ask about suicidal ideations. We ask about all these things and resources. And hey, if this happens, then you need to do this and X, Y, Z. And we're able to prescribe those medications safely. Putting barriers on this makes no sense to me, and it actually just limits, again, access to care. We do not need to keep putting up barriers to care for patients. That does not keep them safer.